So I was asked recently about what do I do for my diet, and it's pretty simple. I'm a big believer that less is more, and that ultimately the primary focus that I have for my life is glycemic control. I want to minimize the impact diabetes has on my life and use it to an advantage as much as I can. And so with that goal in mind, I typically focus on protein-based foods first and foremost, around 50 grams per meal. And then I have fibrous forms of carbohydrates, that could be broccoli, spinach, ultimately to minimize the amount of glycemic impact from these type of foods. Ultimately, carbs have the biggest impact on postprandial hyperglycemia, so I just work to minimize that because I don't want to deal with the ups and downs that is pretty notorious in the world of type 1 diabetes. Then for fat, I don't really focus on it. I just let it come along for the ride, and it ends up figuring itself out into caloric neutrality. And at the end of the day, this is my approach, but each person has to do what works for them in their life, and ultimately what are their primary goals, whether it be managing their diabetes or focusing and or on performance. And ultimately it's a very nuanced, complex disease, and requires a lot of insights and focus, but again, you can manage it however you want, but these are the approaches that I take ultimately to achieve normal glycemia, which is the goal of staying in normal ranges as often as possible.